Hi, so today is World Thrombosis Day and I want to talk to you about DVTs, deep vein thrombosis, blood clots. Now, a lot of people will come to me and go, is there any reason I can't have acupuncture? And I'll say, yeah, if you've got an active blood clot. Full stop, point blank. You have an active blood clot, I'm not going to treat you. Equally, if you've been on a long haul flight within 14 days, I'm not going to treat you at all. Not with massage, not with acupuncture. I might do with a bit of reflexology, not guaranteed. Definitely not with MLD. Pretty much that's about it. Yeah, you could have arpaio candling because it's not going to make much of a difference. But I will not treat patients when they've landed for mostly a minimum of 14 days if it's a long haul flight. I may say 7 days if it's a couple of hours. And I may just say you've got to leave it a few days before I treat you if it's just maybe an hour or two. And obviously, depending on their medical history, it would depend if I extend that time period in between appointments. And people think, well, why is that? Well, it's really simple. Acupuncture moves blood, which means it's capable of moving a blood clot. And a lot of the time, people get off the plane and don't know they have a blood clot. These can occur up to a week or so after you have landed. So if you don't have symptoms straight away, but the blood clot is there and we give you acupuncture and it moves it, it could move it to places that are more deadly. You know, pulmonary embolism happens. That's where the clot has moved to the heart. You can also get them go into your lungs and they can also go into your brain and cause strokes and bleeds. This is why we have to be so careful. So what are the symptoms then of a DVT that people should be looking for? And please do use the flight socks. I know they're uncomfortable, but they make a difference. So the things you should be looking for is any change in skin colour, specifically around the leg. Now, it could be one leg, it could be both legs, but you would be looking for mottling, a new redness or purpling, a bit like it's a mottled colour. It often starts in the calf, but it isn't always in the calf. It's majority of the time. So if you've got suddenly a new colour or change in your thigh, get it checked. You can also experience cramping, soreness and swelling. Unusual swollen ankles or swelling around the knees, swelling around the thigh, swelling around the calf. And that often there's a tenderness that goes with it. Kind of like a heavy feeling. And of course, it tends to feel warm to touch. And specifically, it's often around at the back of your leg, just below your knee or just above it. So check for redness there as well. If you are feeling any of those symptoms, please do go and get them checked, especially if you have been on a flight within 14 days. This has been Thoughts with Points. Take care on World Thrombosis Day.